Hi, this is Courtney Austin, and this presentation is on the roles and scope of non-nursing health professionals for Nursing 532, Role Development and Leadership. What is scope of practice? Scope of practice helps to identify procedures, actions, and processes an individual is permitted to perform. An individual's scope of practice is also based on specific education, experiences, and demonstrated competence. Applying a collaborative team approach to a patient's care is becoming the new normal. There is a reason for this. It's because it works. When all interprofessional team members on a patient's care team work together, the patient's outcome is improved. Although it is effective, it can be tricky to pull off. To do that, they must understand each member's education, scope of practice, and areas of expertise. Learning the language, norms, and special foci of all other disciplines fosters more effective use of resources and knowledge. Two examples of non-nursing health professionals that perform within a set scope of practice and are also an important member of the patient's care team are radiologic technologist and respiratory therapist. Radiologic technologists are the healthcare professionals who perform diagnostic imaging procedures such as X-ray examinations, magnetic resonance imaging or MRI scans, and computed tomography or CT scans. Radiologic technologists are educated in anatomy, patient positioning, examination techniques, equipment protocols, radiation safety, radiation protective, and basic patient care. Beginning in 2015, individuals must have earned a minimum of an associate's degree in order to sit for certification exams offered by the American Registry of Radiologic Technologists. Respiratory therapists' knowledge of the scientific principles of underlying cardiopulmonary physiology and pathophysiology, as well as biomedical engineering and technology, enables them to effectively assess, educate, and treat patients with cardiopulmonary disorders. Critical thinking, patient environment assessment skills, and evidence-based clinical practice guidelines enable respiratory therapists to develop and implement effective care plans, protocols, and disease management programs. Respiratory therapists practice under medical direction. Respiratory therapists have a minimum of an associate's degree from an accredited respiratory therapy education program. Having multiple healthcare professionals collaborating in a patient's care can lead to conflicts. Communication breakdown being a key contributor to conflict. Maintaining clear communication is vital. Professionals practicing outside of their scope or not to the degree of their scope requirements can lead to an inaccurate data collection and ultimately poor patient care. There are many services and interprofessional healthcare professionals that are involved in one patient's care. Although many, they are all important. They each play an especially important role, but it is important for the nurse to know and understand their own roles along with other interdisciplinary team members' roles. Understanding your individual scope of practice and staying within your boundaries is each individual's responsibility. These are my references. Thank you so much.